for item C1 first. Mrs. Umberto.
Under the educational related mental health service little box, under residential assessment, placement, and monitoring services are in place. I just want to personally thank, her name is Maureen, and I can't think of her last name. She has gone way out of her way to actually help and intervene on behalf of a child right now, and it's an extreme case, and she's really reached out, and she's been really working with the parents and with the program specialist at a school district. And I want to thank you for doing that, and thank you for utilizing her for that, because so far she has done an excellent job. And I really want to thank you, Joan Riley, for doing that, because we're really utilizing her right now. My next thing that I'd like to say is that usually when you do residential placement, there's an assessment that needs to be done. It's a 60-day assessment. We explained we don't have 60 days to wait for this child. This child is that dangerous to himself and others. We could not wait. She took what we had to say, she took the documents, read them, and she acted. Okay, and it's only been, I think, 5 days. I think it's only been 5 days, and she's done an awful lot for this child, and she is looking for resources. So, oh, I'm sorry, she did it the same day. So I really want to thank you for that, and that they overlooked the 60-day assessment, and they did it right away. So I really want to thank you for that. And also, I want to thank Amy Foodie for going to the training for the ADR. You're going to be awesome doing that and training people, and I hope you will do a presentation for the CAC. You do a wonderful job training and explaining things to people, and I really appreciate that you got the opportunity to do it, and I appreciate that Joan Riley allowed that training to happen, because I know with the budget and stuff, you know, we have to be careful how we spend our money, and I feel it was utilized correctly, and I really would like to thank you on that. And then I just have one other thing, or actually, the other one is the expand of the clinical staffing. I want to thank you for that. It's working out really great. When referrals are being sent to WESELPA, they are being acted upon promptly. And in the past, there's always been problems with that because the staffing was short back then. So I want to thank you for that, because they are acting promptly and they get back to us and they call us parents. And I want to thank you for that. And the only thing that I would like is under residential, it's one of the last boxes, the parental liability form developed. If I could get a copy emailed to me, because I'm not exactly sure what that's for, and if I could see that, I would appreciate it. Thank you.
Thank you, Mrs. Winter. Next we have Mr. Palmer.
I just wanted to speak again. I think ADR is the same thing as the mediation training, and I'm thankful too that Amy was able to go to that. I did want to point out that as a parent, it is a struggle when Ms. Foodie comes to your child's IEP and is supposed to be a neutral party, but sits with the special ed director and really just stands there as a wall or an obstacle to your child getting services. It becomes very challenging then in the informal resolution hearing when Ms. Foodie shows up as the mediator to feel like there can be a trusting relationship, and you can really trust that the mediator is someone who's neutral and who can help that process. So I'm trying to point out there's a systemic problem. And I pointed that out to Ms. Foodie when she then returned to my child's IEP. She attended my child's IEP for 2 years. Not to help me and get services for my child, but to stop me from getting services for my child. And so when we went to informal dispute resolution, it was very challenging to try and work collaboratively with the person who was the obstacle the entire time for 2 years. So I would just encourage the system to be looked at, and so that parents can have in good faith enter into this informal dispute resolution, so they can walk in and feel that they have a neutral mediator that's there and that's present. Hopefully those are some things that were talked about at the training. Hopefully those were some things that you were able to learn about from that training. But as a parent, I could not in good faith trust that the mediator was neutral, if that makes any sense to anybody. I hope it does make sense. And when she returned to my IEPs afterward, I would present that it was a conflict of interest, that she was there actually facilitating my daughter's IEP as the due process manager. That's an extreme conflict of interest. And it puts us as parents, puts me as a parent in angst in my heart, in my mind, not to be able to trust the process, not be able to trust the system. So I would ask that you look at that systemic issue and you get a mediator who can be neutral and get a mediator who is not out there in the field preventing children from accessing services. Thank you.
Thank you, Mr. Palmer. Are there any members of the board that want to comment? Hearing none, we're going to move on to item